DSM, which stands for the Diagnostic and Statistical Manual of Mental Illnesses, this is the Bible, the psychiatric Bible of mental diagnoses. And this first came into being in 1952, and the book was like this thick. And nowadays, we're in what we call the DSM-4. It's the fourth edition. Actually, there's been 5, and the book is like this big, and they're planning another one that's going to be coming out in a few years. Now, historically in the DSM, which is a publication of the American Psychiatric Association, that very few diagnoses are taken out. They are added. Lots of diagnoses are added. And so 1980 was a real interesting year because that was the year of real gigantic childhood expansion of diagnosis. So prior to 1980, which was the DSM-3, there was no such thing as oppositional defiant disorder, which is one of these diagnoses that I often talk about with people from the media, and they think I'm being sarcastic because they ask me, is that for juvenile delinquents? Is that for kids who are really getting into trouble with the law? And I said, no, that's a whole other diagnosis. That's conduct disorder. Oppositional defiant disorder kids are doing nothing illegal for the most part. They're just arguing with adults. They're refusing to comply with adults. They're angry with adults. They're resentful with adults. Those are the official symptoms. And that's what's added in 1980. Attention deficit hyperactivity disorder, that was thrown in 1980. The interesting thing was 1980, there was one famous diagnosis that was taken out. And it actually had been taken out in the 1970s, it had been taken out. But it had been in the DSM-2. And it's very telling how it was put in and why it was taken out. Up until the DSM-3, homosexuality was a mental illness. In the early 1970s, there was gay rights activists who got very upset about being called mentally ill because they were gay. And so they became politically active. And one year there was actually the APA, the American Psychiatric Association, one that bright, they had their convention in San Francisco. And they got protested in major ways. And they got scared. They literally, these psychiatrists really got scared of these gay guys and these gay women. And there were gay psychiatrists who were in the closet afraid to say anything, but they were kind of rooting for them. And politically, through lots of political processes and demonstrations, homosexuality was kicked out as a mental illness in the 70s, and it wasn't in the DSM-3 in 1980. And the important thing for people to remember is that it was put in, obviously, for political, cultural reasons as a mental illness, and that homosexuality was taken out for political, cultural reasons. And in fact, every so-called disorder and illness in that DSM is in there for political, cultural reasons. Some of them are just more or less obvious. Homosexuality was one, oppositional defiant disorder outside of the American Psychiatric Association's pretty obvious to the American people that that's not an illness or even a disorder. That's just something you don't like. You'd rather kids be more compliant, so let's call them a mental illness. But I would tell you that almost all of these things, there's very few conditions in that DSM that are actually organic conditions that you can see with a lab test or an X-ray. And most of those are not really psychiatric conditions. They're neurological conditions. The vast majority of the things in the American Psychiatric Association's DSM are just behaviors that people have decided they don't like because they create havoc within a family, within a school, within a society. When you talk about diagnoses in psychiatry, there's almost zero reliability in any kind of diagnoses because when you take a kid, I've seen many, many kids who've come in here diagnosed by some other doctor with attention deficit disorder, hyperactivity disorder. I've seen many, many kids, and I ask, well, how is this diagnosis made? And it turns out always that these diagnoses were made by these questionnaires that were handed out to parents to fill out or teachers to fill out. And routinely, I'll look at these questionnaires and I'll tell a kid before I even meet them, I'll say, I bet you I know which teacher that you really like. And of course, it's the one teacher that didn't diagnose the kid with attention deficit hyperactivity disorder. So what determines often whether an adult perceives a kid with ADHD or any of these other diagnoses is, how much trouble that kid is giving them, how much they like or dislike that kid. They won't admit this, but I see this all the time. And so when you take a look at the reliability of paper and pencil subjective tests, it's going to be very low. Or you move towards depression. How is that diagnosed? If you take a look at these drug studies that assess people as being severely depressed and assess their remission rate, they're often used, the most common measurements that's used is something called the Hamilton Rating Scale for Depression. It's within the public domain. People can look it up on the internet. They can look at these questions themselves on this Hamilton Rating Scale. And what you'll discover is that there's an awful lot of questions there that have to do with your sleeping. So for example, you can earn 2 points for having difficulty going to sleep, 2 points for difficulty staying asleep, 2 points. You can earn up to 6 points for having difficulty sleeping, which is almost enough points to make you declare like you're in remission or out of remission. How many points do you get if you're thinking seriously about killing yourself? Only a couple of points. Why is that? Well, these tests are loaded up so that it's more likely, these drugs are going to affect things like your sleeping. Drugs can make you sleep better. Are they going to make you feel less suicidal or not? Well, they set up these tests, these evaluations, these measurements, so it doesn't matter so much. So in fact, you've got antidepressants, and this is not Bruce Levine saying this. This is finally now the Food and Drug Administration, the FDA, black box warnings saying that these antidepressants, Prozac, Paxil, Zoloft, make it more likely that a young person, a kid, a teenager, young adult, will have suicidal thoughts than if they're not taking them. Okay? Twice as likely, actually, if you take a look at the statistics. And so you have to ask, what kind of population buys into the fact that something is an antidepressant drug that actually makes it more likely you have suicidal thoughts and feelings? That seems to me more like a pro-depressant drug. But, it doesn't seem that way, I guess, to a lot of doctors out there who are being told that just because, the FDA approves something for something, you can use it.